Excellencies, heads of state and the government, ministers of health, and His Excellency WHO Director General Dr. Tedros, and WHO Regional Director Dr. Punang Singh. Ladies and gentlemen, it is indeed a privilege to speak at the opening of the World Health Assembly, and as we celebrate the 75th anniversary of WHO, it is a special occasion and comes at a time when the world is just emerging from COVID-19, the most disastrous health crisis in a generation. Dr. Tedros, a few weeks ago, you stepped down the COVID-19 pandemic as a global health emergency. Even as we must remain vigilant and learn the many lessons from this pandemic, it is also a time to reflect. But first, congratulations. Our heartfelt felicitations and gratitude to WHO team, every health worker, every social worker, and every family member that care for the sick and the dying during the COVID-19. Without your untiring efforts, often going well beyond the call of duty and putting your own safety at risk, our victory over this formidable foe would not have been possible. We see superheroes on film, but WHO teams and health workers around the world are our superheroes in real life. We also know that we lost far too many of our loved ones in this pandemic. This is also a time to remember their loss and acknowledge their grief. Our heartfelt condolences to their families, friends, and loved ones. And finally, some reflections. Public memory can be notoriously short, but if we do not heed the many lessons from this pandemic, we will be doing ourselves and our children a great disservice. Let me share 3 of my reflections, and all of them are about resilience. The first is the resilience of our health systems. Every country, big or small, rich or poor, struggle to mount an adequate response. The pandemic reminds us that we must build our house before the storm, not during the storm. Every country needs to invest in strengthening health system to be more resilient for better health security. This pandemic has also pushed all our health and health-related SDG targets further off course. There is much work to win back the hard work gains of the last 2 decades. The second is about personal resilience. The pandemic was more deadly for those with long-term illnesses and other health conditions. We must all work together to create an environment where it is easier for people to be healthier. Whether it is better nutrition, more physical activity, less use of substances harmful to health, or cleaner air, we need all sectors to work together to help build personal resilience and a better immunity. And finally, societal resilience. The biggest threats to humanity include those from climate change and the next pandemic. Neither of them respect national boundaries. These are transnational issues that demand a transnational response. As a small climate vulnerable state, my country knows this all too well. In this interconnected world, we need wise counsel to bring us all together. I look to the specialized agencies of the UN, like WHO, to continue shoulder this responsibility. On behalf of the people of my country, I extend my heartfelt gratitude to all the WHO teams for being the trusted partner, for the high-quality technical assistance and commitment to improvement of the health of our nation in collectively realizing the dream of health for all. Let me thank the Director General, Dr. Tedros, dear friend, Regional Director, Dr. Poonam Singh, and WHO Country Office in the 75th anniversary for your support and guidance. We are WHO. We are family. Thank you, and God bless you all.